This is the case study assignment that I use for my clinical students. Each student needs to select a patient and they fill out the case study document, which I'll go over here in a minute, and it has a table that they can use to collect the different data that they need. They have to interpret and give rationale for different information in that table. They will also then answer specific questions that are in the assignment. These are questions that address higher order thinking levels, and then kind of have the student critically think in order to be able to answer these questions based on what they know and drawing a conclusion from that. Part of this assignment also includes the creation of a patient education product, and this is something that they can use any type of digital tool that they would like. It could be a video, it could be a screencast, podcast, movie maker, publisher, whatever they want to use to develop some type of patient education product that could be given to a patient to educate them about their disease, what the standard treatment is, and the guidelines on when to see a physician. The whole purpose of this is to try and prevent hospital readmissions, which is a big thing in the hospitals right now that my students are addressing. There's also a presentation involved, and in this presentation, media is incorporated. So they do give a media presentation to their peers. This allows for peers to ask questions and stimulates discussion throughout that. They also need to reflect on what they have learned as a result of completing this study, and they have to share that patient education product. So we have technology being used within the patient education product. This is something they can use their creativity to design whatever they would like. And then we also have media or technology used within their presentation itself. And throughout the whole thing, it's built in specific questions that help them address critical thinking issues. So let's take a look at the case study document. And here you can see they basically do a chart review. They're going to gather all this data out of the chart. So they are guided to ensure that they get the right information that they need to be able to answer the questions. They do need to interpret or provide a rationale for that data or testing that was completed. They do need to do research in order to find current scientific literature that helps them with their patient's diagnosis or treatment. But here are the questions. The guided questions are going to help with critical thinking. How do those findings related to the patient's disease and diagnosing the patient's problem, what the standard treatment is, what would they recommend. They need to predict if the patient were to improve or deteriorate, what's that going to look like? And then, again, some more self-reflection. What influence will this have on their professional career, and what have they learned from this? Ending here with the designing the patient education brochure. And I've asked them to be creative using some type of media, any form that they would like. So it is pretty open, so they can choose whatever they're comfortable with. This is an example of one of those patient education products that one of my students did. And you can see that they chose to use Publisher here. They did a brochure, but there's lots of pictures involved in different ways that they express themselves. And this is here the back side, so you can see that as well. So returning to this page here, this is a website that I designed for them. They can get on here. They can find out all about what's involved with the assignment. There are links here that they can look at the document, see the grading rubric, learn whatever they need to about the presentation and what's involved, and the grading rubric for the presentation, along with some tutorials. So this is my project that I have used to try and incorporate all of those things that we've been talking about in the presentation into an assignment that could be used for students.